Hello, welcome back. Today, we are doing a mobility assessment. In my last video, I talked a lot about why it is important to have proper mobility and what immobility can do to you, how frustrating or depressing it can be not having enough mobility, and how much freedom you can have if you have enough mobility. So with having enough mobility, you can do basically whatever you want. So today, we're doing a quick assessment that I do with my clients so that you can see how much mobility you have. And I told you in my first video what I think should be normal to consider to have normal flexibility. And I said to you, it would be ideal if you were to be able to get up and on the floor without using your hands. Okay, I'm going to show this to you, how it should look like. You're sitting here, crisscross applesauce, and you should be able to get easily on and off the floor. Or anything like that, or the other side, anything like that. So you should be able to do this without using your hands. So and I ask you to give me a rating. If you're able to get on and off the floor without using your hands, that's a 10. If you need your hands getting out of your bed, this is the 1. So today we're doing a quick spine mobility assessment, and then I show you exactly how it should look like. And for each, we're going to do 4 movements, and I would like you to rate each movement that I do with you. If you are able to do this, you're going to give yourself a 5. If you're not going to be able to do this, it's a 1. So best score would be 20. Okay. So you give yourself 5 points if you can do it right, and 1 point if you're lacking. Okay. So all you need to do is a mat, and we're using a pillow to support our head so that we're not hyperextending in our neck. So you're on the floor. You have your legs up in a 90-degree angle. You have your arms sideways. 90-degree angle in your knees, 90-degree angle in your legs. I suggest having your legs against the wall so that you're able to maintain that angle that you're not losing this angle here. So you have your arms on your side, and then you keep your knees together and you bring your legs towards one side without coming up with your shoulder here. So your shoulder should be touching the floor. I'm going to show this to you this way. And then you bring your legs up, and then you bring your legs towards the other side without coming up here. Again, arms sideways, you bring your legs towards one side. Your legs should be touching, your arms should be relaxed. And then you come up and you bring your legs towards the other side. Nothing should be hurting and nothing should be feel tight. So now we're doing a similar movement, but we're starting on our side. So you're on your side with your legs in the 90-degree angle right here. Arms are here. You keep your legs up here, and then you bring your arm back. So in this position, when you move your arm back, your shoulders should be touching the floor, and you should be able to keep your legs completely relaxed. If you're coming up here, this would consider to be not normal. So you should be able to be relaxed. If your shoulders coming up, that's not a 5, that's a 3 or 4. So then we're doing the same thing on the other side. You're on your other side, and you bring your arm all the way back. Your shoulders should be resting. If your shoulders coming up, that means you have some mobility problems in your thoracic spine. So I would like you to give yourself a rating. Maximum score point is 20. If you are 19 or 20, you consider to be like normal and you're perfectly fine. It's almost impossible to reach that level. When you are between 13 and 18, you have some work to do, but you're okay only if you sit on the couch and if you're not moving. Everything that's below 13 is like a red flag. So I can guarantee you that you have an injury, you might have had an injury or plenty of injuries in the past, or you might have recovered from an injury. So moving forward, if you do not work on mobility, there's some other mobility assessments that I do with my client. This is just one little piece. It gives you information of how much movement you have in your upper spine and how much movement you have in your lower back, thoracic spine and lower back. So you need to have, as I explained yesterday, you need to have a certain amount of range of motion in your thoracic spine and in your lower back. So if there's a lack of mobility, there's always a risk of getting injured. So if you are below 13, I can guarantee you that when you do some type of movements, that you will always have some problems in the future. And I would like you, or I'm offering you a free 15-minute phone consultation. I have some spots open. So if you're interested in finding out more about this mobility assessment and you want to do some more assessments, give me a call or send me a text message or a direct message in the comment section, and I will get back to you. Tomorrow, we are talking about strength, why it is important to have proper strength. So I see you guys tomorrow. Have a good day.